I am going to talk today. So I spoke in the spring about GI manifestations in Fabry disease. Today, I'm going to talk about some of the nutritional aspects that can be considered, mostly related to the GI symptoms. At the end, I'll briefly touch on anti-inflammatory diet, but there's really not much data on that in general. And then specifically in Fabry disease, as many of you may know, there's not great data on nutritional interventions. And so we'll I'll kind of explain things as we go along, but there's not much data to support a lot of it. Okay, so you can see the screen okay, the nutritional overview?
Yeah, looks really good.
Okay. So just to get started, as we know, most Fabry patients are treated with some form of Fabry-directed treatment. So a lot of times it's enzyme replacement therapy or chaperone therapy targeted at the Fabry aspect itself. But despite ART or other types of treatment, many clinical aspects require specific targeted treatment. So for example, with GI symptoms, which I talked about before, many patients do improve on megalostat or ART, but still the data has shown that up to 2/3 of patients with GI symptoms continue to have symptoms even after Fabry therapy. And GI symptoms typically affect the quality of life frequently. And so it leads us to think that we really do need to specifically target other aspects of the symptoms and not just the Fabry disease itself. So there aren't any specific studies examining the role of nutrition in Fabry disease, but we believe that consideration should be made to help with specific symptoms via the nutritional route, and particularly GI symptoms. And so a lot of what I'm going to talk about tonight is treating symptoms that's seen in the general population that are also seen in Fabry disease. Some of them we think are related to underlying similar mechanisms of disease. Others just maybe some similar symptoms that can respond similarly. So for tonight, I'm going to talk about GI symptoms and Fabry disease briefly at the beginning because we've talked about that previously before, but it'll be a good, helpful setup to understand the nutritional aspects that I'm going to talk about. I'll spend a little time talking about the GI physiology, and then I'll spend a majority of time talking about various diets that may be implemented that may be helpful. And I'd be happy to kind of address any questions that you guys have about specific diets to the best of my ability. I am a gastroenterologist. I'm not a specific nutritionist, but we do a lot of nutritional alterations with our patients. And then I'll also talk about GI diseases with specific diets. And so underlying GI diseases that may be more prevalent with Fabry patients, and specific diets or behavior modifications that we think can help with some of the symptoms. And then finally at the end, I am going to spend a few slides just talking about an anti-inflammatory diet that is hypothesized to possibly help in Fabry disease, but there's no data to support that at this point. So in terms of symptoms, in GI symptoms particularly, as many of you know, GI symptoms can be very common with Fabry patients. Abdominal pain is the most common symptom based on the registry. More than half of patients will complain of some type of abdominal pain. The second most common is diarrhea. It can be all different types of diarrhea. So some is exclusively intake associated. So that would be patients who will say when they have dairy, they get diarrhea, or fatty foods, or lactose. And I'll get into more specifics about that in a minute. Then there's on the other realm is constipation. So many patients will complain of constipation. It is found to be twice as common in female Fabry patients versus male. And the question is this related to kind of the general population, which constipation tends to be more common in females versus males. And then there are the upper GI symptoms, which are things like nausea, vomiting, feeling full easily. And then body mass index has fluctuated. Some studies show that it can be lower in patients with Fabry disease. Others say that it's pretty similar. And then there's severe and rare symptoms, GI symptoms, including perforation of the intestines, colostomy, which is where you have a bag, intestinal necrosis, which is death of the intestines due to a lack of blood flow and oxygen frequently, and then fistulas, which is connections between the intestines. And as we know and has been shown through studies, the GI symptoms can have significant impact on the quality of life. In terms of the physiology behind the GI symptoms, it's thought to be similar to other pathways in other organ systems. And so it's a combination of various aspects, including a vasculopathy. in the accumulation of the GL3 along the cells in the blood vessels, leading to lack of perfusion because of difficulty with blood flow. Also thought to be damage or changes to the nerves, so neuropathies that might be causing some of the symptoms, and then an inflammation and immunologic aspect that's recruiting various immune cells, leading to a cascade of changes in the body. The interesting aspect is that GI involvement does not cause malnutrition. So we don't frequently see patients who are malnourished and malabsorption of nutrients. So if we check stool studies for various proteins or carbohydrates or fats that might not be absorbed, we typically don't see that as an aspect. It's usually normal in Fabry patients. And then with blood tests, including looking for albumin proteins, folate, vitamin B12, calcium, and phosphate are all typically normal. So nutritional aspects are frequently normal levels in patients with Fabry disease. So this is just a nice picture that was from a paper that was put out in 2018, just looking at some of the aspects that are lead into the GI physiology. So one of them is the villi that are in the small intestines might not be functioning as well. And this can lead to issues with uptake of different nutrients, but also issues with enzymes that are frequently released through these villi. And I'll get to that in a minute, specifically an enzyme called lactase that can lead to issues with absorption of lactose. Then there's also a question of the microbiome and the bacteria in the gut. We don't have a great data on, although there are more recently a couple studies that do look like there are changes in the microbiome in the gut that could lead to abnormalities and an imbalance of helpful bacteria and harmful bacteria. And then, as mentioned before, there's this question of neuropathies or injury to the nerves that are in the intestinal wall. And we think that this could lead to many of the symptoms of abdominal pain and diarrhea. So this just is an overview of some of the GI causes that we think are causing some of the GI symptoms. So there's a question of food allergies and sensitivities that I will address in greater detail, but essentially we think about creating a nutritional plan after assessing the correlation of symptoms with specific foods. So that can include aspects of lactose intolerance, a dairy allergy or sensitivity, or gluten sensitivity or allergy. And then, as I talked about in the spring, we do see questionable increased incidence of things like gastroesophageal reflux, gastroparesis, and then an irritable bowel syndrome-like presentation. And we think they may be similar mechanisms that are causing both. So diets that were used for these types of GI diseases can be implemented with patients with Fabry disease if it seems to overlap. And then I'll briefly mention other nutritional therapies that we can address specifically for GI. So in terms of food sensitivities versus allergies, it's a good point to understand that there's a difference between a sensitivity and an allergy. So an allergy can be diagnosed by testing. So this can be done either via a blood test looking for something called antibodies to specific foods. So you can have an allergy to dairy, or an allergy to wheat, or an allergy to beef. And this can be tested by looking at your blood. It could also be done via skin test. So they can, you can see an allergist and they can expose your skin to something and see if you develop a reaction to it. Some of the symptoms you develop with things would be like rash or difficulty breathing, and sometimes GI symptoms too. A sensitivity is different in that there is no known test to determine sensitivities to food. So it makes it frustrating for patients because we can't go and say, oh, you have the sensitivity to this specific food, because we don't have the actual means to assess that. There are places currently where you can pay to get sensitivity labs drawn, but those haven't been kind of studied and aren't thought to be accurate at this point from the medical perspective. So a lot of it in terms of sensitivity is a trial and error. So a lot of patients will take food groups out of their diet and see if their symptoms improve. And that's kind of how they feel the diagnosis is at this point in terms of determining if you have a sensitivity to various foods. Within Fabry disease, there's no known increase in food allergies anecdotally. So in patients that I've seen and in kind of the general Fabry population, we haven't seen an increased amount of specific food allergies. And we don't, based on the physiology that I mentioned before, we don't have a known reason to think that there is an increased risk among Fabry patients. But many non-Fabry patients also have similar GI symptoms that have food sensitivities. So I think this aspect of a food sensitivity could be beneficial for Fabry patients. I don't think the allergy itself is as an increased risk, but as I'll get into later, irritable bowel syndrome patients tend to have more food sensitivities. And since a lot of times we think the GI symptoms are similar to patients with irritable bowel syndrome, it might be helpful to think about addressing some food sensitivities. So to go a little bit deeper into the various diets that can be eliminated, that's kind of removing foods from your diet to see if they improve. I want to start with lactose intolerance, which many of you may have heard of. So it is, by definition, lactose is a type of sugar that's found in milk and milk products. So things you would have heard of like cheese, yogurt, ice cream, butter, and milk all have lactose in it. The physiology behind it is that we have an enzyme called lactase that we produce in the body, and that helps us digest the lactose properly. So in order for when we eat lactose, for it to be digested and absorbed into the body, we need an enzyme called lactase. So in some people over time, the body stops producing lactase, and that can be normal. As you get older, you decrease the amount of lactase that you're producing. And so therefore, as a result, you don't digest lactose properly, and that leads to lactose malabsorption. Malabsorption can then lead to symptoms because when you're not absorbing the lactose appropriately, it stays in your body and could lead to things like bloating and cramping, and this is termed lactose intolerance. The interesting note that I talked about previously is that lactase is released in the small intestine along the villi. So a lot of time if that villi is injured, sometimes the lactase isn't being produced or released as appropriately. And so that could be one of the mechanisms that we think about why it might be that Fabry patients may have an increased risk of lactose intolerance, although this hasn't been documented at this point, but I'm not sure it's been studied, honestly. So some of the symptoms that patients would get with lactose intolerance is gas, bloating, cramps, diarrhea, nausea. And this is because the lactose that we're ingesting is not being absorbed. And so it's being digested by bacteria in the gut and causing these symptoms. For a diagnosis, it's frequently called a lactose breath test, and that's where you ingest lactose and breathe into a machine, and it assesses how much lactose is not being absorbed by the body, and it can take up to 4 hours. Another way to diagnose it is just by removing products with lactose in it and seeing if you feel better. Moving on to a milk dairy allergy, which is different than intolerance. And this is more commonly seen in infants and young children and not as commonly in adults. A lot of people outgrow this allergy, but it's an allergy to one of the 2 proteins found in milk, either casein or whey. And the thought is that your immune system overreacts to these proteins and can cause things like wheezing, anaphylaxis, difficulty breathing. So anyone with an actual allergy, not the intolerance, but an allergy, shouldn't consume any type of milk or dairy. So things to look for if you have an allergy would be to dairy would be things like lactate milk. So it's important to note here, and I'll mention it again in a minute, but lactose is different than dairy. And so someone with lactose intolerance can still have dairy in their diet. So they can drink things like lactate milk, which milk has dairy in it. It has these milk proteins in it, but it doesn't have lactose in it. And so someone who's allergic to dairy can't have any type of milk or dairy product, even if it's lactate, or even if they take lactate pills. But someone who's lactose intolerant can have dairy products if lactose is removed from it. So these are some of the things to look for if you do have a dairy allergy. Sorry. And then there's the milk dairy sensitivity, which is what I mentioned previously, and that patients are sensitive to the milk products, but it's not an actual allergy. So you can develop GI symptoms, and we see this in patients when they're exposed to dairy, so they can get worsening reflux, they can get worsening constipation after they consume milk products, but they get tested for the allergy and they're negative for a dairy allergy. They do lactose testing and they're negative for that. And so this comes out to be more of a dairy sensitivity. So when all the testing is negative, but you still feel like when you ingest these products, they worsen your symptoms, and when you remove them, they're better, that's more of a sensitivity. And so the important thing to note here is that, as I mentioned, choosing lactose-free options are still made from milk. So it eliminates lactose, but it doesn't actually eliminate milk proteins. if you really want to eliminate milk proteins, you need to go through a plant-based or vegan milk or yogurt, because that takes out both the lactose and the different types of dairy. I know that was a little confusing, but I just wanted to clarify it because a lot of times we interchange the two. And so it's important when we're thinking about different ways to treat things that we know the difference between allergy, sensitivity, and intolerance. Again, the importance of a lactose or dairy-free diet in Fabry disease remains to be defined because we don't have high quality evidence and there's no specific nutritional studies that I'm aware of at this point. That being said, as I mentioned before, lactose intolerance could be something that I think theoretically, from a physiological perspective, could be seen more frequently in patients. Then we get to the gluten-free diet, which has become a very popular diet these days. There are many places that sell gluten-free products, and many people feel that removing gluten has helped them feel better. So what is gluten? It's a protein that's found in wheat, rye, and barley. And scientifically, it has been shown to alter the barrier function in patients with irritable bowel syndrome. So that would be the barrier function in the GI tract. And so the thought is that maybe it helps open up some of the cells, and so that toxins can pass through them. But there is conflicting evidence, and it's not clear as to exactly if gluten is the cause or if there are other aspects that are causing the change in symptoms. So in terms of gluten, it's found in most breads, pastas, crackers, cakes, other baked items. It's also in many processed foods, soup sauces, imitation meat, candy, and beer. Essentially, it's in majority of things that you may think about eating, and it's really important to look at ingredients to really assess if it has gluten in it. Similarly to the dairy aspect, there can be a gluten sensitivity and there can be a gluten allergy. So gluten allergy is someone who has celiac disease, which you may have heard of before, and that's when you have antibodies to gluten. So we can do blood tests for this. We can also take biopsies from the small intestines to assess for celiac disease. A sensitivity is you might have symptoms after eating gluten, or when you remove gluten, you feel better, but the testing for celiac disease is negative. That being said, there are many, many people these days who remove gluten from their diet and they feel that they feel better. So there are people who would recommend or continue to use gluten-free diets even if they don't have celiac disease. So if you wanted to avoid gluten in the diet, it is important to read food labels carefully. Avoid products that have wheat, rye, or barley. If it's labeled gluten-free, then you should feel comfortable eating it. But if it's not, you should look for these 6 ingredients, including wheat, rye, barley, malt, oat, or brewer's yeast. All have gluten in them. And I'll get into this in a minute, but it is sometimes used as a treatment for irritable bowel syndrome. And so that's why the thought might be to use it in patients with Fabry disease. So those are the different aspects of some of the elimination diets that could be used or thought about in patients with Fabry disease. Now I want to spend a little bit talking about some of the diseases that I had talked about in the spring related to GI diseases that we think might be at increased risk in patients with Fabry disease, and then some of the dietary alterations that we do to try to address some of the symptoms. So the first one is gastroesophageal reflux disease. And what that is it's refluxing of the gastric content, which is acidic. So it's this down here into the esophagus. So the acid in the stomach comes back into the esophagus. The esophagus is not meant to have acid in it, whereas the stomach is used to having acid. So it's not painful. But when the acid comes back into the esophagus, because the esophagus lining has not seen acid before, it becomes really painful, and a lot of patients will have discomfort. It can cause injury to the lining of the esophagus, and you can get heartburn. You can get feelings of regurgitation. And why do we think this might be more common in patients with Fabry disease? It might be related to the neuropathy that we were talking about before. So maybe at the bottom of the esophagus, there is a muscle that stays tight to keep things from coming from the stomach into the esophagus. In Fabry patients, it might be that this muscle might be weaker because of the changes in the nerves, and so that it's easier for the fluid to come back up into the esophagus. The other thought is that maybe the esophagus itself isn't contracting well, and so that things are moving down into the esophagus or into the stomach, and so it's easier for fluid to go back and forth because you don't have this downward movement that you typically have in the esophagus. And that acid could then stay in the esophagus for longer and cause more damage. So there are various dietary and lifestyle changes that we think can help. So one of them is to avoid, avoid foods that may increase acid in the stomach. And so there are various things, but some of them would be citrus juices and fruit, high-fat foods, including fried foods or full-fat dairy products, so things that have a lot of fat in them. Peppers and onions, some people say, causes some irritation to the stomach. Spicy foods, many people with reflux or gastritis, which is inflammation in the stomach due to acid, will say that that can worsen it, along with tomato products, because those can be more acidic too. So all of these things would be avoided to prevent an increase in acid, which we think is triggering some of the symptoms. Also, we recommend avoiding foods or drinks that make the acid easy to flow to the esophagus. And so, as I was talking about before, part of it is trying to decrease the acid, but the other part is trying to keep the acid in the stomach and not let it go up to the esophagus. And one of the ways we can do this is by making sure that that muscle that I pointed out before stays contracted. And so some of the things that are mentioned here are thought to maybe relax that muscle. It's called a sphincter, so that it's easier for contents to go back into the esophagus. And so those would be things like alcohol, caffeine, chocolate, peppermint or spearmint sometimes, or tobacco. And so these are things that are suggested to be avoided in patients with reflux, so that we don't have an increase of acid flowing into the esophagus. And these are just a few other dietary and lifestyle recommendations that we make for patients who have reflux disease. Reflux disease does lead to abdominal pain. And I think the thing to think about that I told patients is, if you're worried that you have reflux disease, the symptoms are typically in the upper abdomen. So if you're having lower abdominal pain, that's probably not related to reflux. But if you're having either pain in the chest or in the upper stomach, then those could be related to reflux. So some of the recommendations would be to eat small, frequent meals throughout the day. If you eat really big meals, then maybe it stretches out the stomach more, and that could lead to more coming back up into the esophagus. Walking and movement helps with motility of the gut. And so if you walk around more, that's thought to help with some of the digestion and movement of whatever's into the stomach into the small intestine, so that it has less time to come back up into the esophagus. We also suggest sometimes in patients who have more severe disease to avoid lying down for at least 2 hours after eating. And this is because of the effects of gravity. So when you're standing up, it's harder for things from the stomach to come all the way back up into the esophagus. Whereas if you're lying down, then it makes it easier because everything's flat. So it's easier for things to flow back and forth. And this is also one of the suggestions, is to sleep with your head elevated. So people with reflux will sometimes put multiple pillows under their head so that they can stay more elevated and keep things from coming back up. Obesity can worsen reflux, but because it causes more pressure on the stomach, and that could lead to more acid being released into the esophagus. As I mentioned before, exercise is helpful, avoiding tobacco and limiting the large sizes of meals. Then there is gastroparesis, which I also talked about briefly in the spring. And that is slow movement of things through the stomach. So in a healthy stomach, we have something called grinding and propulsion of food. So that's where food comes into the stomach, and the stomach moves around a lot and breaks everything down into the stomach and in the stomach. And then once it's in really small pieces, it moves it through the stomach into the small intestine. And these contractions and the movements in the stomach help both with digestion of food and also passage into the small bowel. If food isn't broken down enough in the stomach, then it will sit there for a long time because it's either too big, or if it's not pushed forward, then it will sit there a long time too. So food must be a small enough size to pass the stomach. There's an area right here where there's a muscle that's pretty tight. And if the food is too big to pass through the muscle, it will just go back into the stomach to get digested more. So why do we think patients with Fabry disease have a higher incidence of gastroparesis? And this has actually been shown in studies. So it's not a hypothesis, it's actually been shown that patients with Fabry disease do have a higher incidence of gastroparesis. They can have poor contractions of the stomach. And this goes back to what I mentioned previously, that the nerves themselves we think aren't working appropriately. And so you don't have the stomach contracting, therefore leading to decreased digestion of food in the stomach. It sits there longer because it can't pass through. And then it also sits there longer because there isn't that muscle to push it all the way through, or the contractions that will move it forward. And there was a study that was put out several decades ago now by O'Brien, where he looked at 7 patients with GI symptoms and looked at, did a test called a gastric emptying scan, and found that 5 of them had a delay in their gastric emptying, meaning that 5 of these patients had gastroparesis and slow movement of the stomach. And he also looked at the biopsies taken from the stomach and saw that there was an increase of GL3 in the ganglion cells and the nerves, and those with the delay in the gastric emptying. So that is all consistent with an abnormal movement of the stomach in patients with Fabry disease. The symptoms include nausea, pain, early fullness, and vomiting, which are many of the complaints that Fabry patients can have. So the diagnosis is made by a gastric emptying scan, which is when you eat a standardized sandwich or test case, which is frequently an egg sandwich, which I always find is odd, particularly with patients who are having GI symptoms. They probably don't want to have an egg sandwich, but essentially you eat the sandwich and it's radio labeled, and then you take pictures and see how fast it moves through the stomach. The treatment is we have medications that I talked about previously that we use for gastroparesis, but frequently in milder disease, we use just dietary modifications. So that would include small, frequent meals to give the body time to pass food through the stomach. And so what we would, rather than having 3 meals a day, we usually say, well, why don't you have 6 small meals a day, and with smaller amounts of food, so that the stomach doesn't have to deal with this large amount of food with each meal. They also have found that foods that are fatty, acidic, spicy, or roughage based that have a lot of fiber can increase the overall symptoms in patients with gastroparesis. So a few things to think about if you think you might have gastroparesis or you've been diagnosed with gastroparesis is that fats slow down the gastric emptying. So that's an important thing to know. It takes longer for fats to be digested in the stomach. And so if you feel that your stomach isn't emptying well, adding a lot of fat will keep things from emptying even longer. And so it is recommended to have a lower fat diet to help move things along. Also, non-digestible fibers, so those are things like fruits and vegetables that haven't been cooked, require contractions of the stomach to actually move them through because they're not digested specifically in the stomach. So in patients who have a delay in the emptying or the contractions aren't working well, then these types of foods will cause increased symptoms because they won't be moved through the stomach as easily. They probably will sit in the stomach longer. So the diet should be low in fat and also in these insoluble fibers, which are the fresh fruits and vegetables. Soluble fibers, which are things that are cooked and that can be digested easier, are fine to eat in larger quantities. You should also avoid carbonated beverages because this can also, the extra gas can lead to increased gas in the stomach and lead to distension in the stomach, leading to more symptoms. And as talked about in other aspects of GI disease, alcohol and smoking can decrease the movement of the stomach and so should be avoided. And then finally, the disease of irritable bowel syndrome is one that has been mentioned a lot in GI pathology because a lot of times we feel that patients with irritable bowel syndrome will have similar symptoms to patients with GI symptoms in Fabry disease. So irritable bowel syndrome is a functional disorder of the GI tract, and it's characterized by chronic abdominal pain. So patients will say that they have frequent abdominal pain that can either be there all the time or come and go. And then they also have altered bowel habits. And in the absence of a, that's supposed to say organic cause. So you can do all different types of testing and they all come back normal, but you still have the symptoms of the pain. And then frequently people either say they have diarrhea or constipation. And it's called a diagnosis of exclusion, which is what we see with a lot of diseases in GI. And a diagnosis of exclusion just means that we've excluded other diseases. So we've done a colonoscopy, we've done other workup, and everything is normal. And so then we say that this is likely irritable bowel syndrome. The important thing to note here is that the symptoms are very similar to the GI symptoms in Fabry disease, particularly in patients with irritable bowel syndrome, diarrhea type, because these patients will have frequent diarrhea episodes, and they also will have this chronic abdominal pain that we see a lot in Fabry disease. So there's been a question of a possible similar mechanism between the two. Irritable bowel syndrome is thought to be caused by various aspects or underlying issues. The general issue is thought to be related to neuropathy, a disease of the nerves, which we think is similar to Fabry disease. But more recently, there's thought to be an inflammatory aspect, maybe changes in the microbiome, and then maybe some food sensitivities, which I mentioned earlier. So some of the dietary changes that are recommended include reducing intake of foods that may trigger the symptoms. So a lot of the foods have been mentioned previously, but those would be things like caffeine, alcohol, insoluble fibers like the fresh fruits and vegetables, fats, spices, and spicy foods. Other foods that are associated with exacerbations should be avoided too, whatever those are for you. So consider a low dairy or gluten-free diet that I mentioned previously. Irritable bowel syndrome patients can frequently report sensitivities to many foods. And so a lot of times we take out some of these foods to see if this helps with the symptoms. Also, irregular eating may affect the motility of the GI tract, specifically the colon, and that can worsen symptoms. So we do advise you follow a regular meal plan. So have regular scheduled meals with 1 or 2 snacks during the day. It is an interesting thought because I forget the fasting diet that people are doing today, where you don't eat for extended periods of time, can frequently exacerbate some symptoms. And so we do think it's important to maybe have make sure that we have meals during the day and to avoid waiting a long time during the meals. Oh, intermittent fasting, that was it. And then also avoid eating large meals late at night because that can also exacerbate symptoms. So the low FODMAP diet is a diet that I want to spend a couple minutes talking about. It is a popular diet for patients with irritable bowel syndrome. It was implemented around 5 to 10 years ago and has been used frequently with patients with irritable bowel syndrome with some success. And so that's why the thought is maybe patients with Fabry disease who have similar symptoms can try to implement this type of diet and see if that can help with their symptoms. So the physiology behind it, or the thought behind a low FODMAP diet, is that there's something called short chain fermentable carbohydrates, which are a type of carbohydrate that are not absorbed well in the small bowel. So because they're not absorbed well in the small bowel, they can lead to increased water volume. And this can also lead to increased gas production. And with the increased water volume and gas production, that frequently can lead to things like fullness or bloating that patients will complain about, and sometimes some diarrhea. So the thought is to reduce these short chain fermentable carbohydrates, and they are broken down into these fermentable oligosaccharides, disaccharidases, monosaccharidases, and polyols, and that's where the FODMAP diet comes from. And studies have shown that improvement in bloating, flatulence, diarrhea, and other IBS symptoms have been shown in patients who do the FODMAP diet. And what it is you essentially eliminate a significant amount of foods, and I will get to that in a minute, but you take them out for around 6 to 8 weeks. So it's a really hard diet to do, but it's really thought to only be a short-term diet. And the goal of it is to remove many of these foods, see if you feel better, and then if you do feel better, then you do a gradual reintroduction of the foods back into the diet to determine individual tolerance. So you would add one thing back in, see how you feel, add another thing back in, and hopefully find maybe a few foods that might trigger your symptoms more. So these are just a couple charts that I wanted to show to you. These are the FODMAP. These are the type of carbohydrates that make up the FODMAP diet, not anything that you need to know specifically. But these are some of the foods that contain these compounds, which are a lot of them. I thought this picture was actually very useful. So it's not broken down into the type of carbohydrate, but the different food categories of things that are okay to eat and things that you should avoid. So for example, vegetables, I always find the hardest for patients are things like onion and garlic need to be avoided, and beans. And so that really takes out a large chunk of food options. There are various fruits that should be avoided, including blackberries and watermelon, some proteins like sausages, a significant amount of fats, and then a lot of gluten-based things. So gluten-based bread, muffins. And so a lot of times the FODMAP diet, it's not a gluten-free diet specifically, but many aspects of gluten are removed from the diet. And so it's an important kind of aspect to think about, but many patients with irritable bowel syndrome have tried the FODMAP diet. It is recommended that if it is something you're interested in doing, that it's important to speak with a nutritionist first, because to kind of review the aspects of it, because it is such a difficult diet, to be able to kind of go over the various foods that are to be eliminated can be helpful with you sticking to the diet. So moving on to some of the other aspects of nutrition that I talked about briefly last time, but the microbial changes that have been shown, I'm not going to go over those studies again, but what do we do about some of the microbial changes? A big question is probiotics. There's no new data since I talked about it last time, but essentially it's always a question that I hear, should I try probiotics? They are called, probiotics are friendly bacteria or good bacteria, and they live in your body. And the thought is that they help it work well. So they improve the barrier function that I mentioned before, keeping things from going out into the body, toxins from being released from the intestines. They help with the immune system and with pain receptors. They can get into your body on their own, so you can get benefit from them without doing or taking anything extra. Are there any known specific benefits to them? In some inflammatory processes, they have been shown to be helpful. So things like inflammatory bowel disease, probiotics have been found to be helpful. So that's things like Crohn's disease, and also in infectious diarrhea. So if it's caused by a viral process. At this point, we don't know of any specific benefit for constipation or irritable bowel syndrome, but I think as the data comes out, we'll get more information about its role. And there's no known data in Fabry disease to support its use. But in terms of taking it, it's always a question. One thing to be aware of, it's not regulated. So we never know specifically what's in each probiotic. It's not regulated by the FDA like medication is. So there can be all different types of bacteria in every different type of probiotic. But we do think it has minimal risk, particularly if you have an adequate immune system. And so if patients are interested in taking it, I am okay with people taking it. But there isn't great proof that they help, that taking probiotics actually does any good at this point. I think we need more data to really understand the effects of it and knowing which specific probiotics to take. And then other questions about some other additions from a nutritional aspect. There was a thought initially that maybe there's some pancreatic dysfunction in patients with Fabry disease. There was a study that was done a while ago that looked at 28 patients. 7 of them had GI complaints. Everyone was in enzyme replacement therapy, and they looked at their fecal elastase. And elastase is something that's produced by the pancreas, and they looked at it in the stool. The thought is that if this was low, then there may be some aspect of pancreatic dysfunction, but they were all normal. So that's reassuring that we still think the pancreas is functioning normally in patients with Fabry disease. That being said, it is still a small sample, and patients were all on enzyme replacement therapy, and many didn't have GI symptoms. So I'm not sure we can go specifically by the study and say that Fabry patients do not have issues with the pancreas, but it is reassuring. Creon is pancreatic enzyme replacement, and so it is something that can be taken sometimes in patients who have issues with the pancreatic function. A multivitamin is always helpful, particularly with vitamin D and calcium. In any patients, I think also with Fabry patients, although there hasn't been shown to be any nutritional deficiencies in Fabry patients. In terms of other supplements you can consider, ginger is thought to help with nausea. You can take up to 1 gram a day, and that's been shown to be effective in making people feel better with nausea. You know, drinking ginger ale, a lot of people do that when they're nauseous. And then peppermint oil, there's something called IB Guard, and that is a supplement that's sold over the counter that is essentially a peppermint oil. Peppermint oil has been shown to be helpful to treat the symptoms of irritable bowel syndrome. So things like abdominal discomfort, bloating, and gas. And so I do sometimes recommend that for patients. And I think it's something that patients with Fabry disease can certainly try if these are some of their symptoms. And then this has been a frequent question about supplementation with agal. And I think the data, we just don't have enough data to say that's recommended or not. But this was a study that was put out last year that looked at commercially available oral dietary supplementation of agal. And the thought behind is that agal will break down the complex oligosaccharides, reducing the bowel symptoms and decreasing gas production and changing the gut microbiota. And so the study looked at 7 patients, all who had GI symptoms, filled out a questionnaire once a month, and they looked at abdominal pain and diarrhea. And they noted that the abdominal pain decreased significantly, and that after 12 weeks on AGAL, only 1 patient had mild pain. And they also looked at the diarrhea, and that decreased from 2.6 episodes per day, 2.6 days per week to only half a day per week on average. And no one in the study, granted it was only 7 patients, but no one had worsening of their severe GI symptoms. And everyone reported feeling better overall. So the results were thought that an increase in AGAL activity in the patient's blood demonstrated potential uptake of the enzyme via the gut. And that's always been the question: can we rely on the gut to take in AGAL as opposed to having to give it through blood or other aspects? I don't think I can or others can give any specific recommendations based on the study, because it is what we call a pilot study, meaning that's really only done on a few patients. And it wasn't tested against a placebo, and we don't know anything specifically, but it's an exciting study to see that maybe this could help with some of the GI symptoms if it's taken regularly. And then in the last little bit, I do want to spend a little bit of time talking about an anti-inflammatory diet. I want to start by saying that this is based on a paper that was put out last year by Franchini Pezzenti et al. In Italy, where they talked about the role of an anti-inflammatory diet in Fabry disease. Anti-inflammatory diets have been thought about in various other disease processes. There's no great data on it, particularly in Fabry disease, but it's more thinking about how can changes in our diet maybe help with Fabry disease. So just some background is that the lysosomal deposits of the glycolipids in Fabry disease are known to stimulate the inflammatory processes. And I mentioned this at the beginning, that we think that's some component of GI disease, but the Fabry disease in general, we think is related to some inflammatory process. And that also several mechanisms of the immune system are activated in Fabry disease. So although we don't have specific studies in Fabry disease related to nutrition and not specifically to anti-inflammatory diet, it is known that diet is a major environmental factor that can both affect the inflammation process and something called oxidative stress, which can affect the cells in the body. So in recent years, there also has been growing evidence that the microbiome or the bacteria in the gut also play a role in health in the immune system and inflammatory processes. And that's what I mentioned before with the microbiome and probiotics, and that the microbiome can help with the GI tract barrier, so making sure that things aren't released into the body, and that pathogens or things that are toxins don't get released in the body from the GI tract. And that gut permeability, meaning that the ability to move out of the gut related to infections or processes, that can lead to an inflammatory process and lead to low-grade systemic inflammation. So it's helpful to kind of make sure that the barrier is in place. So the thought is that maybe there can be some specific dietary interventions that can change some of the mechanisms of the disease, specifically related to the inflammation and the stress, and that this might contribute to the slowing the progression of Fabry disease. So some of the thoughts behind the dietary interventions would be that overnutrition or obesity is known to induce a chronic low-grade inflammation. And this is not specific to Fabry disease, but just in general, in the general population, obesity can be related to some form of low-grade inflammation. Also, single nutrients and non-nutrient food components, such as prebiotics and probiotics, can help the inflammatory or stress response that we mentioned previously. And that high levels of post-eating glucose or sugar and fat levels can increase the stress and inflammation that's going on in the body. So it's important to have a healthy eating pattern that limits the amount of fats and carbohydrates at each meal. And then, so to take that all together, an anti-inflammatory, anti-oxidative stress diet might help slow the progression of Fabry disease, and specifically some aspects of the disease, such as the inflammatory or the stress component. So in this paper, and also just in general, there's not one universal definition of an anti-inflammatory diet. It hasn't been formulated yet. It hasn't been discussed, but right now the thought is it might be a combination of both the Mediterranean diet and the Okinawa diet that have been proposed. So the Mediterranean diet, and I'll get into a little more detail about it, but essentially it includes foods that we think have anti-inflammatory properties, such as olive oil, tomatoes, leafy vegetables, and nuts. The Okinawa diet is the eating habits of people of the Japanese island of Okinawa. And I honestly had just read about this recently in this paper. And it's a population known for its longevity and low risk for age-associated diseases. So their diet is rich in root vegetables, so sweet potatoes, green and yellow vegetables, soybean-based foods, and also marine foods, lean meats, fruits, teas, and spices. The metabolic effects of this diet include low sugar levels after eating, decreased inflammation and stress that we talked about, and also may be related to some of the biological pathways in the body. And the energy that's consumed from the Okinawa diet is actually mostly from carbohydrates and only 9% for protein. So this was the chart that they have in their paper that I thought was interesting and kind of just broke down parts of the Mediterranean diet and parts of the Okinawan diet. And then some of kind of putting it together to think about an anti-inflammatory diet. And I'm not going to go through specifics of it because I kind of just did it briefly. But I thought it was an interesting thing to think about is how combining these two diets that are thought to have anti-inflammatory properties can maybe lead to changes in the body. So that's all I have about nutrition tonight. The take home from this essentially is that there's no great data on nutrition and Fabry disease. A lot of the thought behind it is taking what we know about nutrition in general and relating it to Fabry disease. I certainly think it could be a helpful thing to explore, particularly this anti-inflammatory diet, but also exploring maybe food sensitivities or the role of other dietary modifications in some of the GI diseases. And just to finish, I wanted to one more time plug our GI study that we're doing. We're actually closing it next week. And so if you or anyone we're looking for one more patient who has Fabry disease, who's over 18 years old, who has GI symptoms and also is either treatment naive or received less than 6 months of any type of Fabry targeted treatment. So enzyme replacement therapy and migalastat, it has to be less than 6 months of treatment. And the goal of it is to learn about GI symptoms to help the greater community and also to understand your specific GI symptoms. And so if anyone is interested or you know of anyone who would fit this, we do cover transportation and lodging, and you're also reimbursed for your time. So please contact either me or you can contact our research coordinator within the next week if you are interested. And I don't know how to get to the next, there we go. And that's it. Hopefully that was helpful in terms of giving you some information, and I'm happy to answer any questions.
That was great. Thank you so much.
Thank you, Dr.
Questions? Jerry, did you want to say something?
Well, I just said thank you. I'm sorry I was a couple minutes late and I didn't get to say welcome and thank you thank you for being here in the beginning, but welcome and thank you all for being here, and thank you to Dr. Zar-Kessler. So go ahead with questions, Dawn.
Sure. So we've got several. I'll start just at the top and move on down. You may have seen these in the comments, but the first one is from Lisa. Is lactose sometimes associated with inflammation of the gut?
So lactose doesn't usually lead to inflammation of the gut. So it's not that you have lactose in your body and it causes inflammation. But what we do see is that inflammation in the gut can sometimes lead to issues with lactose absorption. And so what I had mentioned before with these villi, which are where the lactose is released or lactase enzyme is released, if that's inflamed or not functioning appropriately, then you can see lactose malabsorption. And so in our GI practice, a lot of times if someone has like a bad viral GI bug that kind of causes a lot of diarrhea and it's left the body, they can still frequently be intolerant to lactose after the viral process because they're not producing the lactase or releasing it as well into the body. And that could take some time to resolve. So it's not that the lactose causes inflammation, but it can certainly be a byproduct of it.
Awesome. Thank you. Next one is, hi, Dr. Zar-Kessler. Thank you for your support. Do many people with Fabry experience malabsorption? After 4 years of severe chronic diarrhea predominant irritable bowel syndrome-like symptoms, I did a malabsorption study. I did not have any absorption issues, but enzyme replacement therapy helped a great deal, as well as a medication called cholesterol.
So many patients do not have issues with malabsorption. And that's been an interesting thing that, it shows that things are being absorbed into the body. So we do stool testing for a lot of aspects, including proteins, carbohydrates, and fats. And most patients with Fabry do not have an issue with that. And then those blood tests that I mentioned before, all the levels are typically normal, which can be frustrating for patients because you want to kind of figure out what's going on. But usually the absorptive properties are intact in patients with Fabry disease.
Awesome. Thank you. Are the terms delayed gastric emptying and gastroparesis synonymous? I can't talk today.
Yeah, that's a good question. They are essentially. So gastroparesis is a delay in the emptying of the stomach. More data coming out now is interesting in that sometimes that can change sometimes. And so a delay in gastric emptying is defined by that study that I told you about with eating the egg sandwich. But they've done some studies where they repeat it in some patients, and sometimes in some patients, not all, and not specifically Fabry, just patients in general, that can change. So sometimes they can have a normal emptying, sometimes it can be abnormal. But abnormal or delayed emptying of the stomach is by definition gastroparesis. If you have a normal gastric emptying scan, then you do not have gastroparesis.
What effect does the FODMAP diet have on gut flora?
That's a good question. We don't have great data on that at this point. The thought is that maybe by not having exposure to these short chain carbohydrates, that maybe that will change either the gut flora or the digestion of these by the gut flora, and that could alter the aspects of it. We don't know specifically. I think the bigger question here with gut flora is that we haven't gone from what we call bench to bedside yet. And so we're at the point where we understand a lot about the microbiome, and we can take samples from people and say, oh, look, there's a difference in this microbiome and this microbiome. But we're not at the point of saying, okay, well, this difference in microbiome means that you need to go and take this specific probiotic, and this is what's going to make things better. So we haven't been able to implement anything to know what the actual change we need to do is if we notice differences in the microbiome.
Sounds good. We got a comment. I just had a light bulb moment with gut inflammation. Thank you.
Great.
When toxins pass through the intestinal barrier, is this known as leaky gut?
Yes, so that is thought to be leaky gut. And leaky gut is it's a hot topic that it has been around for a fair amount of time now. And there's been thoughts about, is autism related to leaky gut, and many things that we think, but we don't know as much about it, but there is some thought that maybe what happens in the body is that the cells are connected and they keep things from going from the gut into the body. But there are aspects that we think trigger permeability or ability to move through these barriers that then let things that are in the gut go into the body. We don't know a great deal about it. And so we don't love to say, oh yeah, leaky gut is the cause of all these things, but it's certainly an area of research that's being addressed these days.
You've touched upon this one, but maybe just to make it a little with the brand name. Hi, I recently learned about an over-the-counter medication called Beano that may assist Fabry patients because of the enzyme in Beano. Apparently, it was learned through a study, but I'm unsure where.
Yeah, I don't know the study specifically, but I have had patients both with Fabry disease and then also non-Fabry disease who feel that they do respond to Beano. I don't know of a Fabry specific study that's been done at this point.
So the Linder study is actually on generic Beano.
There you go.
So, yeah. This is just a comment. I just want people to note that if you are strictly gluten-free, be aware that some products have gluten, just to be very thorough in your research and call the company. So just a warning about gluten. And I've got another one down here. What are some possibilities with hypersensitivity to foods high in fat, such as oil? I don't have any problems with eating medium chain triglycerides like avocado and coconut oil. Also, no issues with my technology. Also, no issues with fat-free cheese or fat-free yogurt. I'm extremely sensitive to vegetable oils, animal fat, etc. Even the smallest amount could cause GI distress for hours. Any ideas?
No, I think the one thing to think about, this would not be specifically related to Fabry disease, but a lot of times if the gallbladder is having issues, that the gallbladder releases enzymes that help with digestion of fats. And so a lot of times if someone has fatty meals and then has pain or symptoms afterwards, we do think about the gallbladder if it's specific to fat. So that was not something I got into, but certainly something that can be looked into.
Yeah, thank you for that. Actually, I have a question for you. We have seen some patients who had COVID and then had, moderate symptoms, not necessarily with breathing as much as GI upset and weight loss. And they've found that they're having more issues eating food of all kinds. And so it's almost as if having COVID has reactivated their GI symptoms, whether or not they're on therapy. Have you seen anything with that, like late effects of COVID and GI?
So I haven't specifically, but it is, so what we see sometimes in GI, and this is not related to Fabry specifically, but kind of like an irritable bowel syndrome type of picture. So that could, we could have that overlap with Fabry, is that sometimes viruses kind of either trigger or re-trigger neuropathies or changes in the nerves. And so if there was an inflammatory process triggered by like COVID or other viral processes, and that virus has left, but you're still left with the residual aspects of what that disease or that virus caused. And so what we'll see a lot is something called a post-viral irritable bowel syndrome. And so that's frequently seen with kind of these irritable bowel syndrome type of pictures. It could be post-viral. And so I wonder if Fabry patients who already we know have some type of underlying neuropathy, if maybe COVID or a virus can kind of re-trigger that through an inflammatory process.
Yeah, that's really interesting and makes a lot of sense. So hopefully it'll de-trigger. So he'll feel a lot better. All right, we said great explanation. Thanks from someone. So any other questions? That's the end of what's already existing, but anybody else? You could also unmute and ask a question if you had just one you wanted to ask directly. All right. Well, thank you for a great talk. That was wonderful.
Good.
Yes, thank you very much. The next thing we're going to do, and thank you, Dawn, and I assume that you introduced Dr. Zar-Kessler at the beginning. Great.
I did.
Okay, thank you. I was hoping you would do that in my couple of minutes of absence, but thank you, Dr. Zar-Kessler. I'm going to move into my brief slides for a moment. And while I'm doing that, Dawn will tell you what word to put in the chat box for the prize drawing.
FODMAP. The prize, the comment to put into the chat box to be put into the drawing is FODMAP, FODMAP. And Julie will draw names once everybody's had a chance to put that in there and Jerry's done his presentation.
Dawn, can you see my screen? Great. And while you're putting the word into your chat box for the prize drawing, Julie tonight is going to tell us who the winner is in a few minutes while I get my slides ready. I just need to get into the slideshow. And am I full screen now? Great, thank you. And I can go ahead and start and Julie can tell us the winner at the end. So for every meeting, I just do a few slides of announcements. So the first one is just an update from the industry companies on what some of the resources that they have that would like everyone to know about and that they would like everyone to know about. So starting at the top, you'll see Sanofi Genzyme and the two primary websites that they would like everyone to know about. And after when we publish the recording for this presentation, you'll be able to go back to this slide and look at it in detail at your leisure. So, but just to give you a quick run through. So a couple of websites, and Sanofi Genzyme has a new study called the FD Proof study, which we put on our Facebook page, and we're about to put it on our our website, or rather our newsletter also. And you could see the same. I noticed today that FSIG put an announcement out today of that study also, so you can find it there too. Amicus has their primary website they'd like to share, and Casey has a called Rethink website, and they have also have a webinar series, and the next webinar is 30 November if you're interested in that. But go in the Rethink website and you'll see how to register for those. AvroBio is currently or still enrolling in their clinical trial. So if you're interested in AvroBio, you can find information at the clinical trial site. So AvroBio, Sangamo, 4DMT, and Freeline there, as most of you probably know, are all gene therapy trials. AvroBio is unique in the fact that it is a lentiviral process or a treatment mode. And so the others are different. But so Sangamo, AvroBio are still currently enrolling, 4DMT is enrolling, Freeline is enrolling, and then Idorsia, the one that I skipped in the middle, is the substrate reduction therapy that the enrollment is closed, but we're awaiting news on whether Idorsia will get approval or not. So that's all going on. And you can go back to that slide in the recording if you'd like. So I also like to remind everyone that on our website, in the top menu bar, there's a tab called Company and Clinic Info. And if you go into the Farmer Info tab, you'll see the left box below it, and there's a grid square for each of the companies. And if you go down to the Read More button at the bottom, then you'll see an expanded, a more in-depth list of resources from each company, from videos to PDFs to various things that they're doing, to sites they'd like you to know about. So you can use that also. And then on the right side, I showed the support organization tabs. There's also a tab for clinics. We've got a couple of clinics populated, but support organizations, what I'd like to highlight here, again, you can go into each grid square for various support organizations, see what they're doing. In the NFDF, on the actual website, there's 3 NFDF grid squares. The middle one contains all of the links to all of the recordings for the virtual meeting series. It's just one place you can find them. So you can also go back to the middle square on our grid square in that feature and find all of the recording links. And then they're also, of course, on our YouTube channel and listed in the recordings and archives tab on the registration website. So we still have calendars. The calendars go through April. If you'd still like an educational symptoms calendar, just shoot me an email and let me know if you still haven't gotten one. And the schedule, so we're the 2 we've just done, adjunct therapies for kidney health and nutrition. As soon as we're finished, or in the next few days, the link, the register here link will move over to the recordings link on the recordings and archives tab, and we'll put the new links probably in the next week. We'll have the links for the final 2 virtual meeting series. We finally locked in pulmonology for the last presentation for meeting 18, and we're still finalizing 17. So we'll get that to you soon. All right. Do we have a prize winner, Julie?
We do. The winner is Valerie. Congratulations, Valerie.
Valerie, if we only have one Valerie, I won't have a problem. If we have more than one Valerie, how do we know which one? Well, we can look on the registration and get back with you. All right, so thank you all again. Thank you, Dawn. Thank you, Dr. Zar-Kessler. Thank you, Julie. And thank you everyone for being here, and we'll see you next time. Good night.
Bye. Thank you.
Night.